Anatomy and Physiology, Pregnancy and Its Evolution, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Anatomy and Physiology, Pregnancy and Its Evolution, Things You Should Know, Questions and Answers. This book will help you understand, revise and have a good general knowledge and keywords of pregnancy and its evolution. Part 1. 1. What is the normal duration of pregnancy? The normal duration of pregnancy is 39 weeks. 2. What is the duration of the embryonic period? The duration of the embryonic period is 8 weeks. 3. What is the duration of the fetal period? The duration of the fetal period is 31 weeks. 4. Between which weeks do we talk about prematurity? Between the 31st and the 35th week. 5. How many days is the gestation period? The gestation period is 280 days. 6. What is the gestation period? The gestation period is the period between the last menstruation and childbirth. 7. How long is the oocyte fertile? 24 hours. 8. How long can sperm survive in a woman's genital tract? 1 to 2 days. 9. Where does segmentation begin? Segmentation begins in the zygote. 10. Where does segmentation end? Segmentation ends in the blastocyst. Part 2. 1. What is the function of the placenta? The function of the placenta is nutrition, excretion and respiration for the fetus. 2. The amnion is filled with what liquid? It is filled with amniotic fluid. 3. What is the function of the amnion? The function of the amnion is physical protection of the embryo, maintenance of temperature, and the mobility of the fetus. 4. What is gastrulation? Gastrulation is the transformation of the embryoblast into an embryo. 5. What are the 3 layers of the embryo? The 3 layers of the embryo are the ectoderm, mesoderm, and endoderm. 6. What is the function of the umbilical vein? The umbilical vein carries nutrients and oxygen through the blood to the embryo. 7. What causes frequent urination in pregnant women? Pressure on the bladder. 8. What is the transition period? The transition period is 8 hours after birth. 9. What is the fluid that precedes breast milk? Colostrum. 10. When is this liquid secreted? It is secreted at the end of pregnancy, 2 or 3 days after the birth of the child. Part 3. 1. What stimulates the production of breast milk? Prolactin. 2. What stimulates the ejection of breast milk? Oxytocin. 3. When is child's breast milk secreted? It is secreted towards the 3rd day after childbirth. 4. What is the condition of the continuous production of breast milk? Breast milk production is continuous if there is always breastfeeding. 5. Is there menstruation in a woman who is breastfeeding? Normally no. Menstruation is absent or irregular. 6. What is ultrasound? Ultrasound is an exam used to see organs through ultrasonic waves. 7. What causes increase in weight during pregnancy? Increased weight during pregnancy is caused by increased lymph fluid, blood volume and fat reserves, etc. 8. Why is the intake of folic acid important for a pregnant woman? The intake of folic acid is important for a pregnant woman because folic acid is essential for the development of the child's nervous system. 9. Why is the intake of iron important for a pregnant woman? Iron intake is important because it allows blood formation. 10. Where do you find a good amount of iron in food? A good amount of iron is found in eggs, meat, legumes, spinach, and some fruit. Part 4. 1. Why is it recommended for a pregnant woman to take more iodine? This is recommended because the body needs iodine to produce thyroid hormones. 2. What is the quantity of water recommended for a pregnant woman? From 1.5 to 2 liters per day. 3. What kind of drinks should a pregnant woman avoid drinking? Coffee, black tea, energy drinks, alcohol, etc. 4. What could happen to a pregnant woman who drinks a lot of caffeinated drinks? Delayed growth and miscarriages. 5. Can a pregnant woman follow a vegetarian diet? Yes, a pregnant woman can follow a vegetarian diet, but the important thing is to have a balanced diet. 6. Is it advisable for a pregnant woman to follow a vegan diet? No, it is not advisable for a pregnant woman to follow a vegan diet. 7. Name some discomforts of pregnancy. Some discomforts of pregnancy include heartburn, nausea and vomiting, constipation, edema, muscle cramps, etc. 8. What is gestational diabetes? Gestational diabetes is a high blood glucose level in a pregnant woman who normally does not have diabetes. 9. What is the danger of the overconsumption of vitamin A for a pregnant woman? The danger of overconsumption of vitamin A for a pregnant woman is embryonic malformations. 10. What is the danger of smoking for a pregnant woman? The danger of smoking for a pregnant woman is preterm delivery. Conclusion. Thank you once again for listening to this book. I hope it has helped you in your journey to understanding pregnancy and its evolution.